progesterone as a molecule, it is unbelievably anti-inflammatory, improves our mitochondrial function, which means more energy. These scientists did a randomized control trial, and it was with men, and the men who received progesterone in the ICU had significantly better rates of walking out of that ICU and at a much faster rate. Giving progesterone to men, not a common thing to do in modern society, and certainly not something that has been heavily investigated in any way, shape, or form in modern science and academia. However, over the past 10 years and even the last 5 years, we've seen a little bit more progesterone and male stuff coming around. So a really big randomized control trial was done. And this was really fascinating. I'd be so interested to really dig down as to why these researchers did it, because I know why they did it. Because when you look at progesterone as a molecule, it is unbelievably anti-inflammatory for the most part. It does stimulate the immune system in interesting ways. So I'm not suggesting that it can't cause a blip or a short amount of inflammation in men. I'm not suggesting that. And by the way, we see that in women too, right? As estrogen levels fluctuate, we can see some changes in the immune system and whatnot. But inherently speaking, in general, blanket statement, progesterone is highly, highly, highly anti-inflammatory. I mean, it is literally a pro-mitochondrial benefactor. It directly and indirectly improves our mitochondrial function, which means more energy. So it has a bioenergetic pattern, which I know sounds really hokey, but it's true. It's really important for that. And that's across both sexes. I mean, and that's across other species too. I mean, like progesterone in mammals, that's just what it does. It's very, very, very anti-inflammatory. It's anti-cancer, a bioidentical progesterone. So just with that understanding, I understood that when these scientists did a randomized control trial, and it was with men, specifically men suffering from COVID in the ICU. So we're talking about, I don't care what your feelings are about COVID. Let's just talk about COVID as one of the most significant recent nasty illnesses over the past 100 years. And we know that COVID has very strong pushes on the immune system and significantly inflammatory, right? We see an increase in cytokines. We have the cytokine storm. That's kind of a classical thing that we see in COVID, especially. Now, we see that in flus and many other things too, but it just seems to be really heightened in COVID. We see it especially attacking, and attaching to ACE receptors in the lungs and things like that. So obviously respiratory issues, whatever. So we have these men, and they're stuck in a hospital. And it's a big study. I want to say it was in the hundreds of men. We had one arm not getting progesterone, and we had another arm receiving progesterone in the ICU, men. And the men who received progesterone in the ICU with COVID had significantly better rates of walking out of that ICU and at a much faster rate. So literally like a couple weeks in terms of like how quickly were they healing. And what we saw was that progesterone had a significant effect on inflammation at large in these men. So interesting, right? Because again, that older study, not that old, but slightly older study, small studies showed that if I gave a little bit of progesterone to men, we see some inflammation spike up. But again, association does not equal causation. Now, all of a sudden, we flip that script and we go to several hundred patients receiving the same medicine, bioidentical progesterone, in an ICU with one of the most nasty inflammatory diseases out there. And all of a sudden, these guys are walking away, earlier and better just by receiving progesterone. So can I say definitively, based on the literature, not my opinion, based on the literature, that progesterone is anti-inflammatory in men? Yes, I can. I have no harm in saying or qualms about saying that at all. It's not my idea. This is just what we've seen in the literature. I will say that, yes, there was a study done a long time ago that showed that was not true, or at least that's what they assumed. But again, that was just an associative thing. What we now see in a randomized control trial, a large randomized control trial, giving progesterone to men with COVID, one of the most inflammatory diseases out there, lowers inflammation, and gets people out of the hospital, out of the ICU earlier. Amazing. Incredible. What other things are we seeing with progesterone? I just talked about this in a recent email. When we look at men, specifically men, with good, healthy, quote unquote, baseline levels of progesterone, which, by the way, there's not a very clear understanding of what that is. But let's just assume it's based on the regular reference interval, which I don't remember those numbers exactly. They're very, very small. Men who had quote unquote normal, based on conventional lab settings and standards for reference ranges, men who had normal baseline progesterone levels, who were experiencing suicidal ideation and were combat veterans. Okay, so we're talking about men who served in the military in the United States. They are now veterans dealing with, likely, I'm sure, PTSD and depression and many other things. They are saying that they deal with suicidal ideation if their progesterone levels are, let's just say, normal, or even we could say optimal. Those men do not attempt suicide at even close to the same rates as their counterparts who have, quote unquote, low levels of progesterone. Men who are combat veterans suffering from suicidal ideation, if they have low levels of progesterone, they are more likely, they're at a greater increased risk of actually attempting suicide. Fascinating, right? Because again, this is a signal. And again, by the way, this study is small and it's a signal. Just like we had the signal from the first study, which was like, I think progesterone might cause inflammation in men. Fair enough. That was an interesting signal. If we extrapolate that and we broaden that out and we have a better randomized control trial, do we still see that? No. Okay, cool. So we're going to say that's not true. Now what we're seeing is a new study that is potentially suggesting that progesterone has an anti-suicide effect. It is somewhat preventative. And we understand that, of course, the hormonal, biological nature of the brain and the emotions and the mind and things like that, there's very, very interesting connections there. And we're sorting through those things. But what we definitely know in combat veterans across the board is that optimal hormone levels in general are very, very, very helpful, right? We've seen infamously Dr. Mark Gordon, who's a legend on that front, talk about traumatic brain injuries, men with traumatic brain injuries, especially veterans. That's a very common thing to find in that population of men. If men have experienced traumatic brain injury, they are more likely to also have PTSD. And so the question then becomes, is there an association between traumatic brain injury and PTSD in men? And yes, there does appear to be an association, which is fascinating. And what we've also discovered, at least through the efforts of Dr. Mark Gordon and many other providers like myself and others who have explored this, is that if we provide those men who have a lot of inflammation in the brain, maybe some, God forbid, who knows, some type of secondary or tertiary type of hypogonadism, right, where they're not producing enough gonadotropin releasing hormone in the brain or luteinizing hormone or follicular stimulating hormone. If they cannot produce those hormones, then really the downstream effect is they don't produce any hormones from their sex organs, right? If we don't have enough of these brain hormones, there's no way we're going to get enough progesterone, estrogen, testosterone, DHT, you name it. And so when we give men back those hormones, testosterone, DHEA, and all these sorts of things, we see this amazing effect where all of a sudden the PTSD, the symptoms of PTSD diminish quite significantly. They notice that their quality of life improves. They notice the brain fog go away. All these really interesting things all of a sudden start to develop. And so, okay, we know that exists from an androgen, especially an androgen perspective, right? So I'm talking about testosterone and DHEA and things of that nature, even DHT. We know that these hormones, especially in men, have very, very, very positive effects on mental health. And we know that for women too, by the way, but just to emphasize on men for a second here. So are there not other hormones, practically all of the hormones, of course, don't they all have some effect on the central nervous system and the brain and the way we behave and regulate our moods and whatnot? Absolutely. So where does progesterone fit in there? Well, remember, progesterone as a hormone is inhibitory in many ways. And again, I think when we hear the word inhibitory, it sounds kind of bad, but it's not a bad thing. Like we have the gas and the brake pedal, right? The gas, so to speak, I believe in human beings, in terms of hormones, tends to be more on the androgen and estrogen side of things, right? They're a little bit more excitatory in many ways. They drive libido, they drive motivation and ambition and all these amazing things that we know and love about human beings. They tend to have just a little bit more of a sympathetic nervous system type of drive. Now, I'll give credit where credit's due. Testosterone does also enhance some parasympathetic stuff too, but nonetheless, progesterone, things like pregnenolone, allopregnanolone, these three hormones, they all kind of stem from what's called the pregnane family. So if you can think of the, tree of hormones, from cholesterol is our kind of base molecule, and we'll take that cholesterol and we'll to use enzymes in the body to break that cholesterol down and metabolize it into our sex hormones. And they all start with pregnenolone, and from pregnenolone we get all the other hormones, right? So pregnenolone is really the mother hormone, but pregnenolone to progesterone to allopregnanolone, those three hormones in particular share a lot of similarities in the sense that they all drive down inflammation pretty significantly. They all seem to have inhibitory types of responses in terms of, say, regulating things like estradiol, which is very proliferative and excitatory. So if we think of estradiol, again, as a hormone at large, and estrogen as an umbrella, they drive proliferation, growth. That is the goal of estrogen, right? And we've talked about this with PMDD. Outside of driving cellular growth, grow, we also see on the sense of the nervous system and moods and emotions, it's excitatory. So in the brain, estrogen and estradiol in particular stimulate glucocorticoid receptors, which can stimulate cortisol and norepinephrine and adrenaline and things of that nature, which is, again, not a bad thing. It helps us have a lot of motivation and drive and oomph. Maybe a little bit, just a teensy weensy bit of anxiety, which is, again, not necessarily a bad thing when we're trying to get stuff done. But if we see a lot of that, we can also see a lot of excitatory kind of neurochemicals or neurotransmitters. So glutamate is one. If we have a little bit too much excessive glutamate activity in the brain, it causes a lot of stress. And it can lead to significant amounts of anxiety, more inflammation. It kind of starts that pathway. And again, that's where we see a lot of generalized anxiety disorder, PMDD. We see them kind of fall in this similar pattern. Obsessive compulsive disorder, I think in many ways, we see a lot of that heavy excessive glutamate activity likely stemming from a lot of the estrogenic effects. So progesterone does the exact opposite. Progesterone is inhibitory in that sense. If glutamate is kind of the brakes in the brain, if glutamate is the gas pedal in the brain, what is the brakes? GABA. If you guys remember what GABA, right? So GABA and glutamate, remember those two things. Glutamate is the gas, GABA is the brakes, and our central nervous system at large. Progesterone, specifically because of its metabolization, its breakdown into a hormone called allopregnanolone, this is where we derive a lot of the inhibitory nature in terms of mood and behavior. It tells the central nervous system to relax. Allopregnanolone specifically reacts with the GABA receptors all across the central nervous system, and in particular the brain, of course. And this is where we see a lot of the anxiolytic effects, anti-anxiety effects. This is where we see a lot of the calm and relax. This is where we see a lot of the no more insomnia stuff, right? So if we take that, again, just a broad brush, but if we take that understanding the principles of hormones and we now apply that, we can see that happening in women. We know that PMDD, premenstrual dysphoric disorder, generally speaking, is just a disorder of low progesterone and too much estrogen or xenoestrogens pushing on that poor woman's brain, especially at that time within her cycle where her progesterone is not high enough to meet her needs. And she suffers from what? Typically extraordinary amounts of irritability, anxiety, sometimes even homicidal ideation, God forbid, because their brain is on fire. So when we add what is now an FDA approved medication called brexanolone, which by the way is just FDA's way of taking something as powerful as allopregnanolone and just kind of patenting it. Yeah, crazy, right? We see a significant reduction in premenstrual dysphoric disorder, postpartum depression, like as if they vanish. Most of these medications are typically done via an IV infusion. They're extremely expensive, like thousands and thousands, tens of thousands of dollars. And ironically, all what the FDA has kind of figured out and what these big pharma companies have figured out is, oh my gosh, all we need is allopregnanolone. We've got it. The body makes it. We just need to enhance that. But we don't have to pay tens of thousands of dollars. We can pay pennies on the dollar for just good old fashioned progesterone. And if you take it orally, like I talked about, I'm harkening back to early in the podcast. If you take progesterone orally and it goes through what is called the first pass effect, right? It goes into your GI system and then into the liver essentially and gets metabolized very quickly. Much of the progesterone that you'll take will also turn into allopregnanolone. And all of a sudden, women feel nice and sleepy and relaxed, and they wake up in a great mood and all their anxieties are gone away and all that amazing stuff. And it's simply because we are enhancing we're taking that beautiful progesterone molecule and kind of almost amplifying it so that we can get the best of both worlds. Thank you so much for checking out this clip and tuning in. I hope you enjoyed it. If you really liked it, I definitely recommend that you click here to watch the whole entire video where I go into much more detail. Thank you again for joining, and I'll see you there.